We have to make community treatment the mainstay of psychiatry, not incarcerated treatment, not inpatient treatment, but community treatment.
And the meds that I'm on now allow me to be able to handle all the things that I'm processing without going back into a state of crisis. Welcome to Season 2 of Students of Mind, the podcast where we aim to normalize conversations about mental health. Last season, we connected you with experts in the field of mental health to provide an understanding of topics and illnesses that may not have been easily accessible. This season, we will continue our learning journey together by not only speaking to experts, but also by listening to the voices and stories of real people who are living, surviving, and even thriving, while also facing challenges with their mental health in their everyday life. This season, we want to hear your stories to get the full truth of what it's like to manage one's mental health and navigate living with mental illness. I'm your host, Jayde, and today we are continuing the discussion around psychiatric medications. Today, Dr. Kimberly Gordon-Achebe will talk about racism in psychiatry and the work being done on both the community and structural level to have more cultural competency. In the second part of today's episode, my partner Zen will be interviewing me so I can share with you all some of my own experiences with receiving psychiatric care and being on medication. I hope by listening to the show, you're able to learn something new and gain some encouragement through hearing our experts and listening to the journeys of our guests. However, this show is not a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your mental health professional or other qualified health provider with any questions you may have about your condition. Never disregard professional advice or delay in seeking it because of something you have heard on the Students of Mind podcast. Today's first guest is Dr. Kimberly Gordon-Achebe. Dr. Kim is a double board certified psychiatrist and health equity speaker and consultant. Dr. Kim's work centers around bringing health equity to communities of color, and she has conducted many educational trainings on mental health disparities and inequalities for women, children, and Black and Indigenous people of color, cultural competency, and the racial implicit biases that exist in medical decision-making. Good afternoon. How are you doing today? Thank you so much for being here.
Good afternoon. I'm delighted to be here. Thank you, Jay, for asking me to come and speak to you guys today.
Yeah, of course. I'm excited for this conversation. I've been wanting to have a conversation like this for a while, so I'm really excited. So before we get into the topic of today, can you tell us a little bit about yourself and the work that you do?
Yes, I'm delighted to tell you more about myself. So just start off, I am a child psychiatrist, child and adolescent psychiatrist. I practice in Baltimore, Maryland. Currently, I'm affiliated with two academic institutions, including University of Maryland in Baltimore, but also Tulane University in New Orleans. I act as assistant professor in both child divisions. And I'm also really affiliated with the American Psychiatric Association through the Caucus of Black Psychiatrists, former president of the Caucus of Black Psychiatrists, in addition to various roles and committees that I belong to. But overall, I am a child psychiatrist and a community psychiatrist who works in an assertive community treatment program. We called it Programs for Assertive Community Treatment, which works with people with severe mental illness, both children and adolescents, but also adults. I head the child division for University of Maryland and doing work there. I'm also CEO for a company, a health equity company that provides educational resources, mentorship. If you're a medical student, you're interested in mentorship, look me up. And also provides trainings and curriculums for cultural psychiatry and really helping us understand more about the BIPOC communities and their experience with mental health.
Great, thank you. So I'm doing a small series about psychiatric meds and psychiatry because there's so much debate in the mental health field about the use of meds, the field of psychiatry, and I just wanted to get as many perspectives on this topic as possible. And I know, especially being a Black person, our relationship with mental health in general, there's a lot of stigma, but especially when it comes to taking medication. Before we get into talking about like the experience of being Black and going to a psychiatrist, can you tell us about your journey into becoming a psychiatrist and what it's like being a Black woman in this field?
So yeah, before I get started, Jayde, I have to say that it takes a lot of courage as a Black woman to have a conversation about what that experience is like in mental health care as a BIPOC person. So thank you for giving me an opportunity to tell a little bit about myself and how I actually became a psychiatrist. And it's interesting that you talked about stigma, kind of starting off in the stigma of medications and also the stigma of actually having a psychiatric illness. I remember vividly when I really came to understand that there were certain behaviors, certain things that I was experiencing as a young person that I didn't completely understand. So I grew up in the Bible Belt. Like, I was born and raised in Louisiana. And so being in the South, in the deep South, there was a really big appreciation for church. And that was a source of support for many African Americans who had all types of traumas or experiences with racism and other things, poverty and that sort of thing. And so I knew very early as a young person that, the pastor would be able to, for the most part, support a lot of things. But when someone came in with a mental illness, it was a very different feel. People felt nervous and the pastor even acted different. I remember going to a tent revival as a young person and seeing the pastor lay hands on, like, I don't know if you've ever seen that, but the pastor laid hands on everyone. But that schizophrenic who came in, the pastor didn't feel comfortable with that person laying hands. It was actually some taboo. And so I remember thinking, like, what is the connection between mental health and spiritual, people's spiritual life, and that was, I guess, the impetus for me to really become fascinated with how can we help people who are ostracized, even in their own community, even in their faith community, because of their struggles.
Yeah, I think talking about faith and religion for Black people is really important because that's something that we've used for centuries as our therapy, our way of grounding ourselves, and I think that it's one of the more like difficult topics to kind of like undo the beliefs that exist in religion about mental health.
Right.
And so to keep going, you do a lot of work around racism and how it shows up in psychiatry. So can you talk a little bit about the ways that racism has shown up in psychiatry just through time and how that's changed today?
Well, I mean, I think it kind of goes back to what we were kind of talking about before in communities of how people actually access resources. One of the things that I think is challenging when we talk about racism in psychiatry is that we have to understand that, every societal institution structure in the way it was structured and designed had racism embedded into it. And so, medicine and psychiatry is a noble profession. People go into medicine because they're interested in helping people, and not just their people, but everyone. We take oaths of how we can do that. We do extensive studying in our training to understand different cultures, understand different ways people seek help. But there has been a history, stemming research, for instance, for African Americans to understand like what sort of resources the African Americans have in their community that builds resiliency, that builds, understanding about how they manage their healthcare needs. There's been a lack of African American doctors in medicine. I represent about 2% or 3% of doctors, and then being a child psychiatrist too, I'm a unicorn. Like, there isn't a lot of psychiatrists in general, but when you think about an African American psychiatrist, it's almost like, where can you get those people? And we have to address the pipeline issues in terms of diversity in the workforce. But there's also the societal structural issues. For instance, most of the mentally ill most of the people in the correctional system who are incarcerated, about 64 to 65% of the people who are incarcerated today in state prisons and federal prisons are mentally ill people. And then you think about the numbers of people who are incarcerated who are Latinx or Black. And then you say, we have a problem here that is disproportionately affecting some people other than other people. And some people may want to call that other things. They may say it's because of poverty or societal issues unrelated to race, but in actuality is related to race. And so there are some implicit biases in the way how we manage our healthcare system, how we think about our policies and practices, and also how we exchange our values to communities of color. So that's what racism in psychiatry looks like. It's not an always individual, interpersonal mediated encounters, a structural issue that we have to address. I want to piggyback on what we talked about earlier about the Black family and church, because I think it's really important to highlight that the only form of comfort and the only form of collective community was the church for Black people during slavery, right? It was the only time where, the slave master would allow those enslaved people to support each other and talk to each other. And so there is a historical way that we know that actually helped us in a lot of ways to get to where we are. But it was also a time where it was believed that enslaved people could not have mental illness. I mean, Benjamin Rush, who is the father of psychiatry, he talked about, Black people having a type of leprosy. So if their skin would be a different color, then they wouldn't have, some of the mental illness. And drapetomania, if you run away from your slave master, then you're mentally ill. Those legacies that is embedded in the psychiatric arena has actually played out in other ways. We talk about elopement a lot, patients running away, or, we have involuntary commitments, which may not be a big deal for someone who's coming from a predominant group or another group, but the idea of being chained up, people have these ideas about psychiatry that's perpetuated in the media. Some of that is actually true. We do know that there has been some historical, atrocities made by, maybe well-intentioned people, but at the time their beliefs did not line up to what we would today think is an appropriate way to treat a patient. But those ideas is a part of the struggle that African Americans have, and we can talk about the Tuskegee experiments, but there's been so many experiments that has stigmatized and made, quite frankly, African American people afraid to seek treatment and oftentimes wait until the last minute to actually get psychiatric care.
Yeah, I think that was one of my follow-up questions, is just wondering your insights about the fear that exists about seeking not just psychiatric care, but any type of medical care. I feel like that's a big part of the lack of initiating getting treatment or even seeking out care.
So, I think when we think about, the life expectancy of an African American who lives in maybe in an urban area, that you can look at their zip code and you can say, today we can say how long they're going to live based on where you live. I think there's a very real sense in certain communities that medicine is not designed for me. They're not going to address the needs that I have. So why bother? And I really want to stress more than anything that that's not every African American family. We're not a homogenous group. We all come from different places. Someone who presents with ADHD in, I say, the Deep South, who may have grown up with a bunch of trees and nature and, on a farm is very different than someone who grew up in an urban area that's African American, who have ADHD, who may have had to walk down streets where there is community violence or traumas in relation to poverty and that sort of thing. But they may manifest with the same illness, but have a different idea of how to access care. So we have to be careful not to generalize Black people into one category and say that all Black people are mistrustful of healthcare. But we do have a majority or a group that's disproportionately affected by being more marginalized. And I think that has to do with a lack of psychoeducation about things, a lack of understanding what happens when you go to a hospital or to meet with a doctor. A lot of suspicion about that really clearly could be better addressed just by actually talking to people and really going to their communities and discussing with them, this is what happens next, and this is the step, and actually engaging in community centers, right? It's really important to have healthcare centers be a part of the community in a way that understands the nature of that community. I mean, I know in my training as training future doctors, I will say all the time to future doctors, have you been to a Black church? I know you may not believe in religion, but have you been to, when I was in New Orleans, I was like, did you go to Essence? That'll give you a little bit of flavor of what the ideas and opinions are for the people that you predominantly treat in the clinics. If you haven't gone to a community and see what that community values, you have a hard time actually reaching them. So it really is building a rapport with communities that will help, I think, assuage some of the fears.
Yeah, that's just really interesting to me, having like the doctors go into the community and like experience that for themselves. That feels really like thinking about that being like a standard for doctors or psychiatrists. That feels really good. And that feels like it would make seeking out care a little less scary.
Mm-hmm.
Yeah. So we've talked about, how racism shows up and on like the big picture and like a structural level, but in terms of when Black and Indigenous people of color do seek out care and they're in the office, I know that there are also ways that racism shows up in the interaction between patient and psychiatrist sometimes. And I know on your website you talk a little bit about microaggressions. So can you talk about like microaggressions in those interactions and just some of the other racism that Black and people of color experience when they're in the office with the psychiatrist?
So, it was interesting. In like 2018, I was asked to develop a learning lab, a microaggression learning lab for the American Psychiatric Association. And I did it with actually a pretty diverse group of people, someone who was in the military, someone who, actually two people who were in the military, and really learn about their experience with microaggressions, but also some African Americans and people from the Asian community, and also the Latino and Jewish community. And so in that experience, we learned that microaggressions had the same tone. It was a devaluing of a person's experience, right? So, for instance, there's a really, really great book that I will introduce you to, that I was a part of, The Origins of Racism in Psychiatry. But in that book, it gave case examples of experiences that people of color would have. And I remember one case is distinct is an African-American man who was experiencing, the police brutality and things in the community. It wasn't happening to him particularly, but he was in an environment where there was no place to talk about it. And he was really struggling in his job and having these experiences, not having anybody to talk to. He went to, a therapist like anybody would after a point. He's like, something's wrong with me, I have to get help. And, the therapist was like, well, are you sure that's like what's happening like to you? Like, so it's, really making a person question their experience is one thing that happens. It can be invalidating when someone questions your experience and try to make you feel like, well, what you're thinking is not what, that really didn't happen. And I think that happens actually a lot more. Some of it is discomfort on the part of the provider. So they're trying to be helpful and they feel uncomfortable with the situation because no one wants to be identified as being racist, right? And so they try to avoid, and then that becomes an issue. It's also true that if you are a Black, Indigenous, or a person of color in medicine, the doctors themselves can be microaggressed with their other peers, like with their colleagues, even at the front desk. I remember thinking, particularly when I was in New Orleans and also a little bit here, when I took off my white coat as a doctor, I could tell people treated me differently. I was, medical director of a clinic, and occasionally we would have to involuntarily commit someone or do the paperwork for involuntary commitment so a person can go to the emergency room and be evaluated further. And the EMS workers would come in to pick up the patient and bring them, and they would direct their attention to my white colleague, a medical student. I'm the attending, and ask the question. I'm like, and then the medical student will have to say to them, no, she's the boss. That's who she talks to. And they still would direct the questions to that individual. So microaggressions actually happen all the time. It's everyday encounters that's based on implicit biases. Some of those biases are conscious, but most of them are probably unconscious. And so I think for a long time in medicine, we tried to talk about implicit biases and microaggressions to help people understand this issue of racism. But I think we have to move past that. Not to say that that's not important, because it is, but I think that there are more structural issues that's making it possible for people to perpetuate microaggressions and have these interpersonal interactions that aren't good for us. So we have to do both at the same time.
Yeah, that makes sense. And my next question is just about what are some of the things being done to help with microaggressions in, well, like you said, help with everything in terms of the amount of racism that's in psychiatry? Because I know you also talk about cultural psychiatry. So, what are the things being done to kind of transform the field of psychiatry? And then can you also talk about what cultural psychiatry is?
Yeah, so I think a lot is being done, and I would have to say that it's the young people, it's the what is the millennials? I get confused about the language, but it's you guys who are saying, hey, medicine has to do better of actually addressing social justice and addressing climate change and addressing these issues with race. And so I've been delighted to be a part of that journey. In terms of educating the future doctors on how to think about that. But I think what is happening in medicine and psychiatry is there is becoming a shared understanding that we have to actually embed this in our structural issues. These are structural issues, so we have to see it that way. And so every institution across this country should be developing their own diversity and inclusion committees around, and I'm fortunate enough to be at two places that's actually doing that. So having those people in place, but also having a educational curriculum that's designed to help, residents and fellows and medical students understand what structural issues look like and what interpersonal biases and microaggressions look like. That actually is harder to do than you would imagine, because there may be one or two or maybe none in your department who has expertise or have experience with that type of curriculum development. So I'm actually fortunate to have had that experience, but a lot of institutions are wondering how to get that information. So I would say that it's time to champion people, maybe someone who's a younger attending or someone even that's in their residency training, to be a part of the curriculum development if you're struggling with kind of coming up with it. But also to not being afraid to do the research too. Doctors do research all the time. So even if you are a white person and you feel like, what do I know about this topic? You can read a book. Just like I have to read a book to figure it out. And I mean it that way, because I think that oftentimes that there's a tax on minorities to develop the curriculum. It's also, I'm trying to remember everything you asked. So what else is being done? I think another thing that's being done is medical students are saying pretty vocally that we need this to be a part of our curriculum, right? And so because that's happening, And medical students pay for their training. So like it really does support a new type of, I guess, advocacy on like all levels, from the structural level, leadership, and then also from the training part, but also people who are coming in and saying, this is things that is important to me and I want to know more about it. Yeah.
Yeah. And then can you talk about what cultural psychiatry is?
Oh, yeah. So, cultural psychiatry, I think, is this understanding that we all bring in our own cultural norms, values, based on our lived experiences. And so what cultural psychiatry does is it looks at, categorical information, identity information, understanding that people may have variations of their identity based on their experiences. But we try to understand the perspective of people based on their cultural experiences. So, for instance, we talked about African American culture. Many people don't understand the Great Migration for African Americans and what that was like. So having an understanding of the Great Migration, having an understanding of Jim Crow and all of those things is a cultural experience. And we teach about that. But we also teach about, things like, religious beliefs and things like that. So that's a cultural curriculum where we're not just talking about this person has schizophrenia. And I also want to say that oftentimes African Americans are diagnosed with schizophrenia and not necessarily diagnosed with mood disorders like bipolar, right? So we talk about those things too. Like that's a cultural psychiatric curriculum where we understand the disparities, and then we talk about how that has cultural implications. The idea of, someone being criminalized or being stated that they're lazy, right? IQ testing that doesn't reflect people's real capabilities, but it was biased. We talk about those things in cultural psychiatry. But we also have moved away from cultural psychiatry with the understanding that you can't be the expert on anybody's culture. You can't be culturally competent. I'm not culturally competent as an African American about my own culture. So like, how is it possible for a doctor to be culturally competent? But they can be responsive and they can be sensitive, right, to those issues. But structural competency, which was coined by created by Dr. Helena Hansen and Jonathan Metzl, who are both psychiatrists, teach medical students and residents and fellows about the structural issues that have racial implications, but also have gender implications and have implications for people who are LGBTQI and more. So we're learning a lot from the work that psychiatrists and psychologists and social workers are doing. One of the things that I will bring up is that when I started doing this work, there wasn't, in my opinion, a lot of literature that was coming out of the medical community. So I ended up having to look at like work that was coming from psychologists and social workers. In sociology and anthropology. And that was a little bit disheartening for me, kind of starting out not having that. So I think that there actually has been a more appreciation for research around those issues in medical arenas. And so hopefully by the time, maybe if you're interested in medical school, by the time you have a bunch of things to look at and to work with.
Yeah, that was something I was going to ask about, is just the fact that a lot of research for psychiatry, it doesn't include Black people. And I know for me as a patient, that's difficult because I can like if I'm being put on a medication and I want to see like the research about it, it's not really based on people like me. And so, yeah, I just wanted to see your thoughts on like what can you do as a Black or a patient of color to kind of like how do we do research to make sure the treatment that we're getting is going to be effective for us?
Your question is awesome. And I think that, there is a need for community participatory research. And so in the past, when there was research questions about Black people or Latinx people or Indigenous people and other people of color, there wasn't a support for the grant money or the funding that you need to actually do that type of research. Mm-hmm. And even better yet, there wasn't support for publications around that research. And so we have a generation and generations of African American and other people of color research that was never funded or supported in a way for us to understand some of the stuff. Now, pharmaceutical companies who make medications are required to get enough diversity for them to be able to get FDA approval. But I don't think people really understand that as much as we would hope that they do. But it's also true that we actually need more African American people and African people and people of the African diaspora to engage in participatory research. But it has to be collaborative. Like it has to be in a way where there's appreciation that there has been this mistrust. And so you have to be very transparent about the research that you're offering to communities to have them feel comfortable to engage in that type of research. But we have to also recognize that research has been stymied, that there are scientists and educators who had the information that we needed 30, 40, 50 years ago that are now just getting attention and recognition now from people who are interested in studying that. Because those people in the 1960s, I mean, if you look at some of the stuff like Chester Pierce, his research on microaggressions, he coined the term, you don't think he could have given more information? Yes, he could have if he would have been given an opportunity. So we have an opportunity now. And this is the time where we see the influx of what's happened with COVID, the tsunami of mental health crisis in America. This is the time where people are suspicious about, getting a vaccine or hesitant about getting the vaccine. It all comes from historical lenses, narratives, and things that we have to work out. But we have an opportunity now because it's no time like now to try to get this right. And I think that I feel optimistic about what's happening in medicine and psychiatry. But again, I'm optimistic because young people are saying, no, this is our time, and we're gonna make notice to those things, take notice of those things.
Yeah, I feel that too. Like I definitely, especially in the past year, feel optimistic just about just about mental health in general and how it's starting to be talked about more, taken a little more seriously. And I think in that, being comfortable with just seeking out care in general, I think that's gonna increase a lot, especially with like the amount that these things are being promoted on like social media. So yeah, I'm very optimistic too.
Yeah, so we have like people like Taraji P. Henson and her foundation, Boris Lawrence, I think it's the Boris Lawrence Foundation, but Henson Foundation. But she's talking about therapy and her having actually went through therapy. I do think that we're still struggling though with medications. Like, so more Black people are interested in therapy and signing up for therapy, but not as many are comfortable with taking medications. And we know that with some chronic mental illnesses, the way you going to get better, not that therapy is not going to help. Therapy is very important, but they're also going to need medications to stabilize their moods or to, decrease psychotic symptoms like hallucinations. Those things don't go away with therapy. And so I'm hoping that in addition with the connection that people are making with their therapists, they're also making a connection with medical providers who prescribe medications to treat illnesses.
In terms of, kind of like normalizing and taking some of the stigma away from taking medications, do you feel like that's something that can be made better by like focusing on those structural things that we were talking about? Or do you think there really needs to be more things on like the community level where we're educating about the like effectiveness and sometimes the need for psychiatric medications?
Yes, I mean, I don't think it's one or the other. I think it's both. So, the structural issue around taking medication is how medications are introduced, right? If your first introduction to taking the medication is a traumatic experience for you, let's say you're having a break in your consciousness, you're experiencing hallucinations, you're not sleeping, you're not feeling well, and someone is telling you because you're not able to do all those things, you're not functioning, that it's time for you to be hospitalized, and you feel like you're signing your rights away when you really are just getting treatment. That's not a good time to tell a person that they need to get over their mistrust of the system, right? And so then a person is free and they go home and they feel a little bit better and they say, well, I can do this on my own, so I'm not going to take the medication. That is actually the time to actually engage with them, like check on them and make sure that they are connected to a doctor and a therapist. But usually what happens is people are getting emergency treatment, they're getting inpatient treatment, but when they go into their communities, there is no infrastructure for community treatment. Or your insurance company may say, well, that's too expensive, so we're not going to pay for it. But actually, it's more expensive to do inpatient and acute care, in my opinion. I can do the research a little bit, than it would be to have some community supports that feels good. So we have to do that. We have to make community treatment the mainstay of psychiatry, not incarcerated treatment, not inpatient treatment, but community treatment. We also have to market medications better, right? We have to market it better. We have to ask patients what their experience was like with medications and their side effects and their things, and help them understand that, yeah, that's a part of it, but there's another part of it too. I can't tell you how many times I have a patient come to me and say, well, I don't want my child to be, for ADHD, I don't want them to be addicted. There is really no evidence that you're going to be addicted from an ADHD medication. There is a lot of evidence, however, that if you don't treat a kid who has severe ADHD, they may go on to have substance abuse problems. But it wouldn't be because of ADHD medication. It would be because of untreated symptoms that over time lead to life failures. You're not doing well in school. Your friends think you're annoying and impulsive. You always make rash decisions. You're risky. You can't keep a job. You forget things, and then you decide to smoke marijuana. Nothing's wrong with marijuana, but if you start to smoke marijuana and you're not doing well otherwise, it's probably not going to go well for you, or alcohol and things like that. And so oftentimes we don't have that type of conversation with people about medications in a way that feels safe, because you have to feel safe with your doctor to have that conversation, by the way. So there's a lot of variables.
Yeah.
I hope it helped.
Yeah, no, I think that's really helpful. I think even for me, just in my desire to advocate for mental health care in general, but specifically medications, that helps me kind of understand the best way to do my advocacy work, because I've been someone who's been on medications since middle school. So for a long time, I've been on the boat. I know that medications help me be able to do the work that I do in therapy. And so it's been hard to kind of communicate the reasons why medications are helpful to other people. And so I think having you talk about I think it was really important for you to say that jumping in when someone was hospitalized and then they felt a little better and then they go home and they're like, oh, I don't need medication. I think that's really important to mention, that that's one of the crucial times to kind of reinforce the importance of medications and what they're doing to help someone.
It just made me think about something. But we actually have more situations of people committing suicide directly after treatment because you feel better, you think you're better, and then something happens and you impulsively hurt yourself. So we really have to make those quick connections when people are out of the hospital and engage with their family, engage with their community supports around, mental health. And I'm just, really impressed with you, Jayde. Thank you so much for being transparent and sharing your journey and your story with your family, but with your community, and also this podcast. Because I think that helps. People need to know that their doctor understands, or another person experienced that too. I remember being 9 years old and watching my aunt, who had bipolar, drive around the street that we lived on. She just drove around in circles for hours. And I think about it now in terms of what I see the trauma that many Black women have had, it was almost like a I guess analogy of her life. She felt like she was just going around in circles and she wasn't getting anywhere. And that makes me emotional when I think about it. But she did take her bipolar medications, because what was told to her at the time would happen to her if she took those medications, and the messaging that, you're crazy if you take these meds. So, she would go to her doctor and she would tell her doctor that she's taking her medications. And because he did lithium levels, I don't know if you heard of lithium, but it's a medication for bipolar. She would take more of the medication when she was going to see the doctor. So her lithium level would be at a certain level, and that caused her kidney damage. She ended up being on dialysis. So, there's really some real harm when doctors doesn't understand the culture of the people they meet, because they make these snapshot decisions, not understanding that people are telling you what you want to hear out of fear that you're going to see them a certain way if you don't ask them, hey, I'm noticing that you telling me to take the medications, but I really don't believe you. Let's talk about it, and I'm not judging you, because taking medications are hard, and it probably feels unfair too with everything else that you've been through, that we also need to talk about intergenerational trauma, right? And how everyone has the same genetic makeup, but because of intergenerational trauma that you inherited or whatever, it's opening up, mental illness. And we're seeing how adverse childhood experiences, right, is causing a whole generation of people to have mental illness that may not have had it if we had better structures. That's what we talk about when we talk about the social determinants of health, the social determinants of mental health. Where you live, where you work, where you play, where you worship matters. Black minds matter, Black lives matter, mental health matters. And it's just as important as physical health. Like, you wouldn't tell a person with diabetes, oh, child, don't take your diabetic medication. It's going to get better. We're going to be fine. We don't do that. But we have stigmatized psychiatric medicine so much that people are fearful, literally fearful about what that means if they are diagnosed.
Yeah, I feel like even what you said right there could help someone who's on the edge, not sure whether to make that decision to ask for help. I feel like that could be really helpful for people. And again, I think just speaking about it, like you said, that's the reason for the podcast, is just to continue to have conversations about this, to just make it less scary. I think
Yes.
I think there is even for me, doctors are intimidating. It's sometimes really nerve-wracking to speak up for yourself in a doctor's office, just in general. And then when it comes to something like talking about your mental health and someone's administering a medication to you that's supposed to be helping, and if you're feeling a side effect or it's not helping in the way that they say they were, it can be scary to speak up about that.
But, we're supposed to, talk to people about what their experiences are going to be like,
Mm-hmm.
right? We're not supposed to wait until they have an experience to inform them from day one. The moment you start the medication, you're supposed to be educating your patient about that experience, So I actually sometimes take a lot of time before I even start a medication, just to make sure that the person has some buy-in, that they understand. Now, I can't always do that, because if it's an acute situation, it's important to get a person medicated so they don't harm themselves or others and they're stabilized. But if you have that opportunity to engage in more conversations with a person to make sure that they are clear, their questions are answered, they've done their own research. I oftentimes tell people, places that they can do research that actually is standard of care, that is actually coming from experts, because not every research is good. Like, you can go down a dark web and looking online for answers, and then that would just make things worse. But, giving them the opportunity to do their own research and come back to you is really, really important. But it also means that we also have to change the structure of how we practice, right? And that's a whole nother issue, but doctors oftentimes don't have the time to do that. But there may be other people who can help with that. A nurse practitioner, a social worker, someone, a PA, or even just reimagining what psychiatrists can do, like reimagining that we're not just medication management specialists, but we're therapists too, and we're, psychoeducation experts and all that type of thing. I can go on a tangent, Jayde. Keep me on track. And you have some questions for me.
Yeah. So I think something that you can probably just send me. I was going to ask about, like you were talking about, you have certain places you send people to do their research and some literature. So maybe you can like send a list that I can include in the notes for people.
Absolutely.
Yeah. And so my last question, which is what I've been asking during my interviews, is just what's something that you wish people knew about the field of psychiatry, just in general, and then also what do you wish more people knew about racism in the field of psychiatry?
That's two hard ones because it's so much to say about psychiatry. If you're a person that's interested in becoming a psychiatrist or training in a psychiatric field, you can do just about anything. You can work for any type of community. There's so many opportunities for psychiatrists. I actually talked to a psychiatrist just the other day who's consulting on a film, right? Because of his clinical experience and his understanding, he's asked to consult on the film. So, medicine, I think, is coming to appreciate that we have some very skilled people who can do many, many different things. But what I hope that people understand the most about psychiatry as someone who treats patients every day is that you are not alone, right? That mental health issues are very real and is prevalent today and may become even more prevalent. So because you're not alone, I can guarantee you there is somebody in your community, maybe even somebody in your home that's suffering the same way as you who needs help. And psychiatry is actually, to me, in my opinion, the real medicine, because if the brain and behavior doesn't work, nothing works, right? Nothing can work the way it should when we don't take care of our mental health. In terms of like racism in psychiatry, I would like to say that racism in psychiatry is real. Can we stop questioning whether or not racism is real in every part of medicine? Because it is. When we stop questioning it and stop saying, well, I'm not a racist, and become anti-racist, right? When we become anti-racist, we begin to say that I noticed something that's not right, and I have the power and the privilege to do something about it. I have a lot of power as a Black woman and professional to do something about it. So if I feel I have power to do something about it, and I come from a marginalized group because of societal issues, then everybody should feel empowered that they can do something about the issue. So the only thing I want to talk about racism in psychiatry is that, can we stop questioning whether or not it's real or not? I mean, can we just move forward and get some real work done? But, we all have implicit biases. We all have things that we're going to keep thinking, even if we hope to not think that way. But just because you think it doesn't mean it has to play out in your behaviors, in your decision making. I can be an inclusive person and still struggle with certain people's decisions. It's not mutually exclusive. And that's what we're trying to get at here, that we can actually make it a society where people aren't disproportionately affected by mental illness because of their race. They're not disproportionately incarcerated because of their race. They're not disproportionately affected by educational system and housing and all of that because of their race. So I guess that's it. I said more than I thought I was going to say, but I also want to say that it's very uncomfortable to talk about this. It's hurtful. It's harmful. It's traumatic for people to talk about these issues. It's scary. We need to have more psychologically safe places for people like me, for patients like me, to have these conversations and not feel like there's going to be some backlash or, some gaslighting or, fear of losing your job or your reputation or, your livelihood because you have a different opinion than maybe somebody else. That's what needs to stop.
So lastly, I just want to ask, what are some ways my audience and I can stay up to date with you and the work that you're doing?
That's a great question. So follow me on Twitter. I'm not a big Twitter person, but I think if you follow me, you'll see if I'm doing something big. If I'm doing an educational resource, you'll be able to follow me anyways. It's at Dr. Kim Answers. So at Dr. Kim Answers is how you can find me on Twitter and on Instagram and on Facebook. You also can, if you're interested in mentorship or executive leadership on how to become a person who practices health equity in your workplace, you can look me up at bhetcgroup.com, bhetcgroup.com, and hopefully you can provide the information to them so you can get more learning and experience about me. I also have my website at drkimanswers.com. You can find me there. But, more than anything, you can find people like me at Black Psychiatrists online, also on Twitter and Instagram. So there's a number of ways that you can interact with someone like me. And also, I want you guys to remember that there's not that many of people that look like me in the field. And so we are sometimes taking a while to get back to you. But I hope to be able to connect everyone with someone who can be helpful.
Thank you so much.
Thank you.
Yeah, I'm really excited to share this conversation. I really appreciate, you giving your insight on like the field in general, but also sharing like your personal experiences, because I think that's really important to also like humanize psychiatrists a little bit more and share about the Black psychiatrist experience. So thank you so much for being here.
You.
I'm about to share some of my experiences with psychiatrists and medication. And I just want to emphasize this is, what I've experienced, and this is by no means the standard or what every person experiences with finding the right psychiatrist or finding the right combination of medications. And I also want to note that a lot of the kind of adverse side effects that I experienced with some of the medications happened before I received genetic testing. And that genetic testing helped let my doctors know, the types of medicines that would work for me and the type of medicines that wouldn't work for me. So after having that knowledge, things with figuring out the right combination of meds got better. But yeah, I just wanted to make sure it's clear that like these are just, my experiences, and experiences with getting meds and going to a psychiatrist is different for everyone. Hi guys, so for the second part of this episode, it's going to be a little different because I had a hard time finding someone to interview as a survivor for this specific episode. I think it makes sense because there's still a lot of stigma around taking meds. And since I'm someone who's been on medication for a while, I thought this would be a good time for me to step into the survivor role. And this will also give you guys a chance just to get to know me a little more. So today I have Zen with me. Zen is my boyfriend, and he is someone that's been really helpful in my healing process, and he knows everything about me. I've told him about, my healing journey up until we met, and then he's been a part of that journey for the past 4 years. So yeah, I thought he'd be a good person to have on to ask me some questions about my experience with psychiatric meds. Welcome, Zen.
Hello. I'm really happy to be here, and I'm glad that I can interview you and your audience can learn a little bit more about the host of this wonderful podcast. So, yeah. I was going to originally ask some questions just so people can get to know you. So let's talk about where you're from.
I'm from Baltimore, Maryland, but we currently live in the Bay.
So why'd you start the podcast?
So for a long time, I've been wanting to do something related to mental health advocacy. And this project actually started as me wanting to create a support group for people at our college where, students could come and talk about things going on with their life and then also receive mental health resources and education. But when I brought this up to my psych professor, she suggested that I do a podcast instead, just because I'm not like a licensed mental health professional. So in terms of like the logistics and safety of a support group situation, you know, I would need a little bit more training to be able to initiate something like that. And, you know, she said that the podcast would be a great way to bring on mental health experts while also being able to like use my experience with my mental health to help other people, because that's really where this all came from, is just since I've been through so much with my own mental health, probably since I was like 15 or 16, just have really wanted to use my experience to help other people in some way, so I can hopefully help someone have an easier time than I did.
So where do you see this going in terms of the podcast, your brand? Where do you see this going?
Well, I really enjoy doing the podcast. I did not expect to enjoy it this much, and I'm really glad that I do. So I can see myself doing this podcast for a long time. But eventually, I definitely want to grow this into something bigger, into something where people can come receive education and resources and maybe even mental health care, all under the umbrella of whatever organization that I come up with.
Okay, well, I think there's going to be an episode where you talk about yourself a little bit more in depth. So let's just get started with the interview questions, all right? Okay, so let's just first talk about your background and your experience with meds. So how long have you been taking meds?
I have been taking meds since I was 12. Yeah, I started at 12 years old after bringing up some symptoms to my pediatrician.
So how long is that? How many years? Just for the audience.
9.
Math.
And
so what was that like? What was that like as a 12-year-old being on meds?
From what I can remember, it wasn't too strange. You know, I have a mom who has mental illness as well. So the idea of like mental health care wasn't completely new, but I also didn't know anyone else besides my mom who was getting any sort of treatment. So yeah, it was new. And, you know, I feel like the first few medications I was put on I didn't really feel any effects from them either. So, you know, it's hard to ask that question because even though I was taking them, it was like I wasn't really feeling the effects.
So, you know, obviously you've been taking meds for a pretty long time. So, you know, meds are a process. Like finding the right concoction of meds is a process, but especially because you're somebody who has multiple diagnoses, multiple things you've had to deal with. What are some of the things that you've been prescribed meds for?
So, like, what are my diagnoses?
Yes.
Yeah. So the first thing I was diagnosed with was depression, which now I know is more considered treatment-resistant depression, considering the amount of medication that I've tried and that haven't worked. And then shortly after the depression diagnosis, it was clear to, you know, my therapist and my doctors that I also had some pretty severe anxiety, and also a panic disorder because I was having panic attacks. So depression, anxiety, and a panic disorder, those are the 3 diagnoses that I'm medicated for. And then I also have an eating disorder, which is a coping skill for those diagnoses, so you don't really get medicated necessarily for an eating disorder.
So through all of those diagnoses, how many meds have you been prescribed so far?
I can say for sure over 20. I think it is important to note that I have a hard time remembering a lot of components of not just treatment, but of my life around the times when I was struggling the most and my symptoms were the most severe. But yeah, from what I remember, it's definitely been over 20.
So, you know, obviously being Black and, you know, just having mental health challenges in general, culturally we're trained to not really talk about meds per se publicly. And, you've taken a lot of meds and you were taking them pretty early. Is there any guilt or shame or just, what are your feelings around the fact that you've, been diagnosed with, this many things and you've had to be treated for this long and you're still being treated? What's that like?
That's a really good question. In terms of guilt and shame, those are two of the hardest emotions for me to tolerate and for me to, get myself out of, I guess. Starting from, when I first started meds, I think I hold myself responsible for a lot of the things that were really not my responsibility. There's a large part of me that wished when I first started getting prescribed medications, I would have asked more questions, or I just would have been more active in my role as a patient in my care. But I can also say now that I was a child.
You were 12.
Yeah, I was a child. And it makes sense that I completely trusted word for word what every psychiatrist was saying that I was either diagnosed with, because I was misdiagnosed with bipolar at one point, and just thinking that the only way to deal with the things that I was going through was to be essentially over-medicated. And, I know also, I think it's important to note that I know my parents also hold a lot of guilt about that time, because all of us were new to just the idea of receiving mental health care for me. I mean, for my parents, having to find mental health care for a child was completely new to them. And so I know that they hold guilt from that time because, being honest, there were some medications that I put on that were more harmful than helpful. But again, we didn't know. We were literally just trying to figure out the best for me. And then in terms of now, I have been in treatment for a long time. I've been getting a lot of mental health care, whether it's in the form of therapy and psychiatry, but also I've been hospitalized a number of times, and then I'm doing pretty intense treatment for my depression and anxiety right now, and it's been a lot, and I have a lot of guilt around needing so much treatment for the amount of time that I've been getting it, and feeling like there's something wrong with me, that it's taking me so long and it's taking so much energy and time and other people's energy for me to get better. And that's something I'm also working on, not having this guilt that I'm just a burden in the lives of all of the people who support me. And even I have trouble not feeling like a burden even to my therapist and my psychiatrist, and to you, and that's something I struggle with. So yeah, I think I have a lot of shame around still needing the amount of treatment that I'm getting right now, but I'm also aware that, I know that I'd rather be doing this now than later in life. And I am able to see improvements now, and I'm doing a better job of not letting the amount of time that I've been receiving treatment fog my view of all the progress I've made.
So in the previous question, I remember mentioning, how being Black affected, those feelings around taking meds and getting treatment. So let's talk about how being Black has, affected your ability to actually get treatment. Because I know that, Black people are disproportionately affected when it comes to getting proper care. So do you feel like you being Black has affected the quality of treatment you've received?
Yeah, in some ways, definitely at the beginning of my treatment, after, kind of immediately receiving a bipolar diagnosis, which is really common for Black people. Another way that being Black has affected my mental health care is around my eating disorder. which for a long time, like while I was super active in the eating disorder before being hospitalized, I just didn't make the connection of Black people having eating disorders because that's not something I had ever seen. I thought what I was doing was, that's a whole other story, but like I just thought things that I was doing was just being healthy, but obviously it turned into an obsession and became an eating disorder. But again, like I had never seen or heard of a Black person having an eating disorder, so it was really hard for me to accept that when it was told to me. And like even after being hospitalized, it was hard for me to be like, okay, like this is actually an eating disorder. And then once I was hospitalized and I had been in multiple hospitalizations, there were barely any Black people. I can think of 2 who I encountered when I was in eating disorder treatment. So, I feel like I've been lucky to have providers who are pretty culturally sensitive. And I've kind of always had like at least like one Black provider. I have a pediatrician who is amazing and was so crucial in me getting the care that I needed when I had my eating disorder. And so having her was also really lucky, like something not a lot of people get, like a Black medical doctor on their side. But having her helped with seeking out the proper care for me. Having a medical doctor that you trust is really helpful in finding resources that will actually work for you, or having any type of provider that you really, really trust and that you feel like understands you to like the extent that anyone can understand a person. That's really helpful in creating a plan of care that'll actually work for you. I think there's a lot of instances where people have relationships with their providers that are pretty distant, and there's not a lot of rapport being built unless it's between like the patient and the therapist. But I feel like, again, like trust is such a big thing, and not even like your doctor trusting you, but like you trusting your doctor and really feeling like you can go to them and tell them anything, and feeling secure in the fact that they're going to listen to you and that they want the best for you. Yeah.
So speaking of trust, I know that you've had a lot of psychiatrists, so I'm sure that you have, plenty of experiences that you've had with those 5 psychiatrists. So what would you say is the most bizarre experience you've had dealing with a psychiatrist or dealing with meds in general?
Well, in terms of with meds, I've had a lot of experience with some pretty like bad and severe side effects from meds. Like one medication I took, it made me slur my speech. So every time I talked, like it was like I had like a whole pack of bubble gum in my mouth. Like I felt like I couldn't like enunciate. So I had that. I had a medication that gave me a tremor, so I would be like shaking all the time, or like when I walked down the steps, my legs would shake, so I had to like hold on to the railing and the wall to get down the steps. And then like the worst one out of all of these was my first psychiatrist prescribed me a medication that I'm actually still on, but back then when I was 12, or I was probably 13 by then, prescribed me 8 times the dose that I'm on now. And that caused a whole slew of problems. But probably the most uncomfortable one was I was having hallucinations because of how high of a dose I was, and then I was on a lot of other medications too. So yeah, that was really hard. And then I've just had psychiatrists who, have 20 to 30 other patients. So when you meet with them, you get to sit there for 15 minutes and all they ask is their like list of questions to check if your symptoms have changed and like if you're suicidal or if you smoked or drank alcohol, like that's like the bare minimum of the appointment that I've had. But then on the whole opposite side of the spectrum, like my psychiatrist now is like basically a therapist too, because she asks me, she asks me about symptoms and how the medications that I'm taking, how I'm doing with them, but she also asks me about school and work and this podcast and like eating. Like I don't even go for her for eating disorder treatment, but she knows that's something that I deal with, and she always checks with me about that. So yeah, I've had the whole range of psychiatrists, from like being strictly medical and not caring about anything else in my life to like now where it feels like I have like 2 therapists.
There's levels.
Yeah, for sure.
Okay, so you've had many experiences with meds. How important were meds in getting you to the point that you're at now? And let me just preface this. You're not fully recovered by any means, just to be clear to your audience. But, you've made a lot of progress. So, how important were meds in that?
Yeah, so you're right. And that's something I am not afraid of sharing, because I don't want to give off the impression like I am recovered and all healed and feeling great all the time, because that's not true. Meds are very important in my journey. They're the reason I'm able to do the therapy that I'm doing. And by therapy, I mean the talk therapy that I do. My therapist and I do a lot of work looking at my inner child, and we do something called parts work, and that takes a lot of energy, and it can get really heavy and overwhelming, and the meds that I'm on now allow me to be able to handle all the things that I'm processing without going back into a state of like crisis and not being able to cope with symptoms, and to know that the symptoms that I feel aren't going to hurt me. But it took me a while to get to a place where I had the right combination of medications that were actually helpful for me. For a long time, probably up until like 2 years ago, it was just really hard for me to even take my meds, because it's just so frustrating being on medication but still feeling like shit. And I have days now where it's like I've been doing this for so long, I'm taking these meds, I'm doing this treatment, but I'm having a hard time getting up in the morning. I'm having a hard time focusing. I feel like my body is buzzing all the time, and that can get really frustrating. But when I'm in therapy and I'm able to do the work, I can just like feel, and I think that comes with age too, just being able to like feel emotionally and energetically. I have more space to process emotions, process things that have happened to me in the past, while also managing symptoms of like anxiety and panic and like lack of motivation from depression. And I have meds that are a big part in the reason why I'm able to do that now. And I also, which I want to do a whole episode on this, but I have to put in a word for psychedelic assisted therapy, because I am doing ketamine assisted therapy, and I'm speechless to how much it has allowed me to process things and allowed me to like look at myself in terms of all parts of myself. And it's helped me not to identify so much with being an anxious person. Like people used to ask me like something about me, and I felt like the only thing I could come up with was that I'm anxious all the time. But now like that's not something I identify with so much, where it clouds all of the other aspects that make up who I am.
Okay, so let's pivot the conversation quite a bit. So let's talk about the current state of meds and how it relates to just the American medical system. So what ways do you think, or do you think big pharma and just the American medical system and insurance and all of that have affected you getting proper care?
Insurance is the most frustrating part about all of this, because they can decide one day that they don't think you need to be getting treatment anymore, and they'll just stop covering it. Like, I was in a partial or a intensive outpatient program for my eating disorder, and I had several weeks left before I was at a point where I would be okay to discharge, and my insurance decided 1 week that that they weren't going to cover it anymore, and I had to be discharged from that program and start like outpatient treatment way before it was planned for me to. So there's that. There's the process of getting insurance approval for medication. Like, I do it every time I see a new psychiatrist and every couple of months, but then there will be a month where I go to pick up my meds and they're like, oh, your insurance hasn't approved it yet. And so I go a few days without meds because even though I've been on this for a while, they take however many business days to approve it again, even though last month I was already taking this. So it gets really frustrating having to deal with insurance. And what's also frustrating is that mental health care is so expensive. So insurance is necessary if you don't have the means to pay out of pocket, which a lot of people don't, because it can get ridiculous. Luckily, like, my therapist isn't covered by insurance, but, I'm lucky enough to be able to pay for that, and she's able to, like, accommodate for my needs a little, which is nice. But, insurance sometimes feels like a barrier to receiving the care that you need, and it can be hard to have the motivation after having to deal with insurance and figuring all that stuff out to then still go in and get your treatment after having to, like, basically convince someone over the phone that you are sick enough to need treatment. And I think that's an issue, because that kind of gives the sense that, like, you have to be in crisis to be able to get mental health care, when that shouldn't be the standard. You should be able to go in and get care before you're in crisis. I think it's frustrating. It's that's also, like, a goal I have, is to be able to contribute in some way in making these services more accessible and less expensive, and insurance less of an issue, less of a barrier to getting the care that people need.
Okay. So what are your top 2 tips when it comes to navigating insurance for your meds?
Give yourself plenty of time. Like, for example, don't wait until you're out of a medication to make sure that insurance has approved your next few doses. So that's a big one. Like, give yourself some time, because insurance takes their time. They're running on their own time. So that's important. Also, it's hard, because I was going to say, like, be patient, but it's really hard. It's really frustrating to have to, like, prove that you're sick enough to be getting coverage from them. So I would just say, like, try not to let that interfere with the actual work that you're doing. And because from experience, I can say that sometimes having insurance say that you're not sick enough to be getting coverage made me feel like, oh, I'm not sick enough to, like, be getting any help. And it just made me feel like either I wasn't actually, like, dealing with mental illness, or it just made me feel really bad about myself, like I wasn't working hard enough. So I would just say, like, insurance is not an entity that can accurately say whether you need or don't need treatment. Like, you know that for yourself. Your providers know that. Insurance is just something that gets in the way sometimes. So yeah, that's a tip I would give too, because that can get frustrating.
So from your story, it seems like especially when it comes to therapy or treatment that doesn't really involve meds. Insurance is just like super gatekeeping when it comes to that stuff. So, some people would see this and be like, they do that on purpose because they want you to get meds, because it's easy to sell somebody some meds, sell the insurance company meds. So, do you, in your experience, feel like meds have been pushed on you more than therapy?
That's a good question. I think I can say yes to that because before my current psychiatrist, I've never had a psychiatrist talk to me about the possibility of coming off of my meds or even coming off of one of my meds. Like, there was never a discussion about, this is how long you'll be on them, or like, you're going to be on these meds till you get to this point, and then at that point we can talk about, coming down. I have never had that discussion with the psychiatrist before my current one.
No, I think it is important to note that I think this is probably the first psychiatrist where you've actually brought that up to them. So, just keep that in mind.
Yeah, well, this psychiatrist and my psychiatrist before, I did bring up explicitly, like, being on meds is something that I first of all, I want to be on like the least amount of medications as possible, because it got to a point where I was on so many medications that it started to get hard to know what each one was doing and if a symptom I was having was the result of this medication or this medication. Like, we just didn't know because I was on so many. So,
like, how many?
The most I've been on at one time is probably like 7 or 8. But moving to California made me responsible for the providers I was seeking out, and, I had to be my own adult and advocate for myself in all my appointments. And so I told them I don't want to have to be on a million medications at one time. And I also want to talk about the possibility of, like, eventually at some point in my life not being on meds, or like being on the bare minimum of meds. Yeah, that's a good point, that like I didn't have the like sense of agency before moving out here to like be like, okay, I don't want to be on this amount of meds for the rest of my life.
Okay, so this is Students of Mind, and one of the missions is to provide resources and knowledge and stuff like that. So I'm going to just ask you a few questions that regard lessons you've learned, with all of this time you've spent dealing with psychiatrists and with meds, and basically things that you've learned that have helped you be more successful and, see more progress in your mental health journey. So just walk us through how you found your current psychiatrist.
So for this current psychiatrist, it was a bit of a unique situation because I was looking for someone who could manage my medication while also doing ketamine-assisted therapy with me. And so that kind of limited my options a significant amount. And then I looked for... first of all, I reached out to her directly. I didn't call the practice that she works at and was like, I'm a new patient, I need a psychiatrist, put me with someone. I reached out to her and was like, hi, I found you on the practice's website and I feel like we'd be a good fit. I want to get treatment for these things and, medication management for this, and sent that email to her. And I also, being completely honest, I was seeking out a provider that wasn't white, a psychiatrist that wasn't white, just because I wanted to have one of the main people in my treatment team be able to relate. I wanted us to be able to relate a little more. So that was also something that I was explicitly looking for in my search. But if I was going somewhere to find, moving somewhere and needed to find a new one, I would do a similar process.
What would be your very first step?
My first step would actually be to go to my insurance website and look for providers through there and see what they suggest, or like the providers that are covered. I feel like that's always a good first place to look because, one, if you're able to find a good provider that's covered by insurance, great, you don't have to pay out of pocket. And two, if you're not able to find a provider through there, that at least gives you like a start and shows you where you can look. So yeah, I would start by going through my insurance and seeing who they cover in the area. And then I also use Google to search for psychiatrists who treat the specific diagnoses that I have. And this is the same thing I do with a therapist. I search psychiatrist, and then my diagnoses, which is anxiety, panic disorder, eating disorder, depression, and then in my area. For my therapist, I added holistic in there because I wanted a therapist that didn't use one form of therapy to treat me, because I just like having multiple methods in order to process some of the things that I'm going through.
Okay, so what do you specifically look for in a psychiatrist when you're doing that search? What are the check boxes that you check off before you even pick somebody?
I want them to be trauma informed. I feel like that's important, especially as a Black person, to have a trauma informed therapist. And then just as a person who has been through a lot of psychiatrists, there's trauma around the lack of effective care that I've gotten. So trauma informed is a big one. Oh, another big one, which is, again, unique to the person, but for me, I need someone who has at least a little bit of awareness, knowledge, education around eating disorders, just because it's hard to be with a provider that's not sensitive to people with eating disorders, because they could potentially say something that's triggering for me. So that's also something that I look for.
Does race matter?
I think that it depends. Like, a white psychiatrist is fine as long as they're culturally sensitive and as long as they're like aware of their privilege. But yeah, so I don't think race matters too much. But then again, I did seek out like a non-white psychiatrist this time, just because I've only had white psychiatrists up until now. But like, my therapist is white.
And she's the best therapist you've ever had.
Yeah, and she's like, literally, I don't have words to describe.
Angel sent from heaven.
Yes, like actually an angel.
So, say you're in your first few appointments with your psychiatrist. What are some things that would kind of scream out to you, this isn't the right psychiatrist for me?
One thing that I experienced with a lot of psychiatrists, where I will tell them something in one session and then the next session it's like I have to tell it to them like it was for the first time. So yeah, if you feel like there's any part of what you're telling them, especially if it's something that's really important to you, if you feel like they're not listening to that, that's a big red flag. Also, if you feel rushed during your appointments, I would say that's not like an indication where you need to like, leave them immediately, but like that's something I would say, bring it up and be like, I'm feeling like we don't have time to talk about everything we need to talk about in our session. Is there anything we can do about that? And if there's no change, then yeah, maybe you should seek out someone else. But I think definitely if it feels like you're not able to say everything that needs to be said, that's a red flag too.
Okay, let's talk about being prescribed a new med. So say in your next session, you are prescribed a new medication. What are some questions you would ask your psychiatrist?
I would ask about potential side effects, how, and usually within there, this next thing falls under side effects, but if it'll affect my appetite, which again is important because I am in recovery from an eating disorder. If it will affect sleep is another thing that I have to ask, because I struggle with sleeping at night. And then also, which this is something that as an adult I think has become more important to ask. And then making sure you are aware of and they tell you what the medication is for and how it's supposed to help you. Like, what's the expected effect? And I feel like if you're able to get all of that information, you have a pretty good idea of like what to expect from being on this medication. I think you should also ask about like dosages, but that's the kind of thing that the psychiatrist usually brings up on their own. And then when you go home after that appointment, do a Google search, take everything you see online with a grain of salt just because it's online. And I would bring whatever you find to your psychiatrist and use that to like ask more questions about the medication.
Yeah, that was going to be my next question. So are there any like specific websites that you go to in order to do your research on that, or is it just like general Google?
I don't use sources that would necessarily be considered reliable.
It's a Google search though, so it's like, you know.
But I sometimes do Google, but I also...
That's why you bring it to the psychiatrist at the end of the day.
Exactly. Because I was going to say, I also sometimes go on Reddit just to see other people's experience with that specific medication. Because since I'm someone who has had experiences with having the worst possible side effect from a medication happen to me, I just always tend to like look up and see like what's common for other people to experience, or just any other side effects that my psychiatrists haven't mentioned, any other possibilities of side effects. So I feel like Reddit, although it's not like a reliable source, it's people talking about their personal experience, and I feel like that can be helpful sometimes. And then if I see something on there that kind of concerns me in some way, I can bring it to my psychiatrist.
Okay, so speaking about side effects, how do you deal with side effects?
You just gotta tough it out. Like, like I'm not good at dealing with side effects at all, because I'm just so sensitive. I'm such a sensitive person, and so whenever I have a side effect that makes me uncomfortable, it's really hard for me to deal with it. And that's why I said, like, you gotta just, like, thug it out until it goes away. Like, one of the worst side effects that I get from a current medication, the one that I'm actually coming off of, is if I miss a dose, even by, like, a couple hours, I start itching, like, unbearable itching. And it's really uncomfortable. It's like chicken pox, but there's no ointment you can put anywhere because there's no actual rash. You're just itchy. So, how do you deal with side effects? It's hard to answer because side effects can be different, but for me, I cry. I have, like, itched to the point of just, like, having scratches all over my body, which isn't good.
So when would you say a side effect is severe enough to bring it up to your psychiatrist and be like, this isn't worth what it's giving me?
I think it's important to bring up any side effect to your doctor, even if it's one that feels good. I think that's important to bring up, because it's all information for your psychiatrist to like put into their knowledge about you so they can understand how you react to medication.
Okay, so let's talk about what you do outside of, your psychiatric care and meds alongside those things, what you do in order to kind of meet your mental health goals or, continue on path of progress, whether it's up or down, sideways.
So therapy is my main anecdote for my mental health right now. Yeah, so I do therapy twice a week. Well, now I'm about to switch to once a week, which is progress. But yeah, I do therapy, and in therapy we do like looking at childhood stuff, processing stuff from there, parts work, which I can put a link in the description about that. We do a lot of like somatic stuff. So I'm someone that feels emotions really intensely, like physically in my body. And so we do a lot of work like exploring the ways in which different emotions affect different parts of my body and how it feels. And we do exercises to help me be able to calm down my nervous system when it gets a little too activated. And then outside of that, I do yoga every day, and I think that's any type of movement is really helpful for me. Whether it's yoga or I've been training to be able to do handstands and all types of like hand balances for the past year, so that's been something that's been helpful. Walks and hikes are really helpful in like being outside. Going on hikes, going by the water to the beach is really important for me, it's great that we live in California now because we have easy access to that. And then also throughout my day, I just have little things that I need to do to maintain my mental health. Hygiene is something that's really important for maintaining my mental health, because those hygiene things, like simple things like showering and like brushing my teeth, those are the first things to kind of go when my mental health is like starting to go in a direction that I don't really want it to go. So doing that, breath work, like little rituals in the evening, like making tea for myself.
I think that, when it comes to meds, a lot of people think that taking a med is like popping a pill and you're good. But even how we differ as people, you are somebody who, requires a little bit more maintenance when it comes to your mental health. And for you take, 4 meds now? And you still have to do, it's basically like managing your mental health is like a full-time job. Whereas for me, I take 1 med and I have a bunch of systems around myself that I strategically place so I can remain on a constant, mental state. And taking that med kind of just helps me have a baseline. So I think it's just important that people realize that meds just help you kind of have a consistent baseline. And then the things you do around, psychiatry, which could be therapy, which could be, some type of psychedelic assisted thing, self-care, showering, those are all things that go into your mental health. And hopefully that makes sense.
Yeah, I think, you're right in that it's important for people to realize that meds are just a vehicle to help you be able to handle the work that needs to be done.
So earlier you talked about how important therapy has been in your healing. I think it's safe to say for you that therapy is like number 1. And one thing that I've noticed that has, even further improved your experience is having your therapist and your psychiatrist be on, communicative terms with one another when it comes to your care.
Yeah, I think it's really important for all components of a treatment team to be communicating with each other, because, we're all working towards the same goal.
Well, at least you should be.
Yes. Yeah. You should all be on the same page about, your treatment goals. So that's one thing that's very important for me when finding providers, is finding people who are willing to communicate with your other providers. And it also helps because, for me, for example, I'm closer with my therapist than I am with my psychiatrist, because my therapist, we've just been working together longer, and our sessions together are more in depth. And so since I'm a little more comfortable with her, sometimes I tell her things that I'm not necessarily comfortable with telling my psychiatrist. And what's great for me is that my psychiatrist, my therapist, and I all meet together every few weeks. And that's helpful for making sure everyone is aware of like how I'm actually doing. Because sometimes as a patient, when you get into a psychiatrist's office, you can say things that may not necessarily be true, but you say them just because you don't want to feel like you're going to make your psychiatrist mad, or like make them think of you in a negative light, or think that you're like not trying or something. Or like those are some thoughts that I struggle with sometimes. So being able to like have us all like in a room or in a Zoom room all together is really helpful in, you know, stating how I'm actually doing, talking about what the treatment goals are, and, you know, they can talk about like their plans, my therapist plans for like what we'll do in therapy, and my psychiatrist's plans in terms of medications and stuff.
Are there any last things you would say about psychiatry and how important it's been in your recovery?
Yes. I wouldn't be where I am today without medication and my psychiatrists. It's been a journey, and it hasn't been easy, but I don't want people like leaving this episode thinking that it's not worth it to seek out psychiatric care, because it is.
I think you've made it clear that it's important.
Yeah, it's just like anything else in life. Like, it's not a smooth journey to get to the perfect mental health care system that you need.
The rough journey makes it worth it.
Yeah.
It makes the end result worth it, because it makes you really appreciate the progress you've made and where you're at, wherever you're at. So
yeah, I am very grateful for, you know, the meds that I'm on now and the journey that I've had, and, you know, I am in a place where things are looking pretty good and the future's looking bright. So, yeah. Thank you for listening to this episode of Students of Mind. I really enjoyed making this one, and I hope you guys enjoyed it and learned something new. If you'd like to follow Dr. Kim, all of her information is in the description below, as well as some resources and links to things that we talked about in the episode. If you want to follow me or Zen, our links are in the description as well. If you have time, please rate and review the show. That helps all of this information and awareness reach more ears. Thanks again for listening, and I'll see you next time.